Welcome to the 6th COVID313 Community Coalition for Families and Students Teletownhall. I'm Christine Bell, a proud member of COVID313 Coalition, honored to serve as the Executive Director of Urban Neighborhood Initiatives and your co-moderator for today's town hall. I'm also a mother of 3 awesome children. Lewis is 6, Quentin is 4, and Emerson is 1. And this disease has turned our world upside down, as I know it has for all of you. Today, we will provide important information and resources so that we're equipped with the knowledge to care for our families during this time. We will also share activities that you can do from home with your family that fit into the chaos that COVID has caused. We are here for you as you navigate this very challenging time. We're translating the town hall to Spanish, Arabic, and ASL, so we want to give folks time to get on the right line and get comfortable. Cindy, please share the phone number for Spanish translation.
Si necesitas traducción en español, por favor habla al 313-626-7440, 313-626-7440.
Saeed, please share the phone number for Arabic translation.
إن كنت بحاجة للترجمة إلى اللغة العربية، الرجاء الاتصال على الرقم 313-241-7030 313-241-7030 وشكرا.
Thank you. Katie, please share the instructions for ASL. Great. Jimena?
Yes, thank you, Christine, and thank you, Julie. Hello, everyone. My name is Jimena Lilly, and I am blessed to serve as the CEO of the Detroit Parent Network. I am a mom, I am a nana, and I'm a proud member of this coalition. And this coalition is just like you. We're parents, we're grandparents, we're educators, we're change agents, focusing on how can we keep each other informed and safe. In a nutshell, while we're providing support, knowledge, and resources, it's about knowledge. And we know that knowledge is power. But in addition to providing knowledge and power information, we're keeping it real. Because like you, staying safe and keeping this social distance, and yes, struggling with the grief and loss that many of us are feeling in our families, in our community, and in our very homes is hard. But we also understand through this process that something else has been revealed. COVID has ripped the veil off of the impact and how deadly racial disparities are. And for those who didn't realize it, now we know how important it is that individually we struggle and combat this, but as a community that we unite to make sure that we have policies that advance the health and well-being of our children, our families, and our seniors, and that we have equity in education and health, and as we'll be talking about as well, economic development. Some of the things that you'll hear today is not only our information around these topics, but we're also going to now make sure that you have some activities of what to do with your children, who, by the way, are with you all day long. In addition to that, we're so pleased to have young people to join us as part of this program to interview those in education. And last but not least, we want to make sure, beloved Detroit, let us continue to work together in our knowledge and to exercise our power and to stay connected. Christine?
Thank you, Jimena. We definitely need to stay connected and recognize our power during this very challenging time. And soon you'll hear from Louis Pinsker, CEO, Wayne Metro Community Action Agency, Marty Fer, Keha, Multicultural Outreach Coordinator, DTE, Dr. Richard Bryce, Chief Medical Officer, Chaz Medical Clinic, Shirley Gray, Director of Sister Friends at Detroit Health Department, Kadada Green, CEO, Black Mothers Breastfeeding Association, Ironetta Wright, Deputy Superintendent of Detroit Public Schools Community District. Ms. Jaishi Batata, I apologize, Director, Detroit Operations, Grand Valley State University Charter School Office. Denise Smith, Implementation Director at Hope Starts Here. Christine from the Detroit Institute of Arts. Kimberly Boyd, Spirit-Filled Yoga and Wellness. Bernita Bradley, Director, Community Outreach, Hope Starts Here. Stay with us for the next 90 minutes so you can stay informed, be encouraged, and powerful. We want to get your questions answered, so we have a couple of ways for you to ask them. You can use the chat on Facebook or text your questions to 313-288-2082. Again, that number is 313-288-2082. We will have Q&A after each segment, and we have some very special guest moderators from the 482 Forward Youth Collective that will be asking questions to our K-12 education experts developed by their peers. If we can't answer questions live today, we are committed to getting the answers to you by early next week. All the questions asked today will be posted with answers on onedetroitpbs.org. Cindy, please share the Spanish translation number for folks that have just arrived.
Si necesitas traducción en español, por favor habla al 313-626-7440, 313-626-7440. Hoy la traducción sería hecha por Doña Gloria Rosas y Liliana Torres.
Thank you. Saeed, please share the number for Arabic translation.
إن كنت بحاجة للترجمة إلى اللغة العربية الرجاء الاتصال على الرقم 313-241-7030. معكم سعيد ونجوى دحدة. Thank you.
Katie, please share the instructions for ASL for folks that have just arrived. And I apologize, it is not Katie that's sharing ASL instructions, it is Julie. Thanks, Julie. To kick us off today, we'll first hear from Cindy Gamboa. Cindy?
Thank you, Christine, and welcome back, everybody. I am Cindy Gamboa. I'm the organizing director at Detroit Hispanic Development Corporation. I'm a proud member of COVID313, and I'm honored to be the parent of 3 wonderful children. Just like a lot of parents out there, these past few weeks since the quarantine have been very challenging for me. My family routine has been flipped upside down. Being at home with a toddler, a middle schooler, and a high schooler has been really difficult. Trying to balance my work responsibilities, making sure that everyone in the house is doing something more productive than just watching TV and being on an Xbox is quite challenging. And then having to decipher all of the different demands that distance learning requires from me and from my kids is also a bit of a challenge. So they are all at different learning stages, have different learning styles, and they're in different school systems. So a lot of times it just has me wondering, am I doing enough for my kids? And I feel like a lot of parents, I hear that from a lot of parents. And at the end of the day, we are doing enough. We're doing the best that we can. I mean, some days I know for me, some days are better than others, but I know that all we can do is, do the best that we can with what we have. So today, I want to urge you to make sure that you're the #1 advocate for your kids. It's very essential right now that we put pressure on everyone to advocate for the education of our children. We know things are moving rapidly, but we want everyone to do their part, especially our policymakers. We need to push them to do the right thing for our children. Please text READ 313 to 52886 to call the governor and urge her to settle the Right for Literacy lawsuit. Lisa's going to give you more information about that in a minute. But today, in upcoming webinars, we're going to be sharing tips for parents from parent leaders on how to parent during this COVID crisis. We know that it's challenging and we should rely on each other to make sure that we're doing the best that we can. Remember that we're going to continue to be here. The COVID313 Community Coalition for Families and Students is here to ensure that you have regular up-to-date information every week. We're going to continue to have regular town halls on Thursdays from 12 to 2 to bring you the most up-to-date information from experts around topics that you're interested in. So please make sure to complete the surveys that we put out there to tell us what you want to listen to, what you want to hear about. We're also going to continue to coordinate any resources that come our way onto one site, COVID313.org. So I encourage you all to please visit that site and get information that might be relevant. And before I turn it over, I did want to do a special invitation. I wanted you all to join a special celebration of Cinco de Mayo. Contrary to popular belief, Cinco de Mayo is not Mexico's Independence Day. It's a day that commemorates the Mexican Army's victory over France at the Batalla de Puebla on May 5th, 1862. Please join us next Tuesday for an evening to enjoy alongside your families and friends, celebrate our history and culture, follow local artists, and visit our favorite restaurants, all from the comfort of your home. This edition is going to be translated into Spanish, Arabic, and ASL. So please join us next week, Tuesday, May 5th at 7 p.m. It's going to be streamed from Detroit Public Television's Facebook page. So we hope you can join us. Now I'm going to go ahead and turn it over to Arlisa. Arlisa?
Hi, thank you, Cindy. Hello, everyone. My name is Arlisa Hurd. I am an organizing member of 482 Forward, a proud mother of 2 sons, and a first-time grandmother of a 6-month-old. My family and I reside in the Focus Hope neighborhood, which is also known as Hope Village. Isn't it amazing that we have made it to week 7 of this pandemic? I know there are lots of reasons to not celebrate, but I think the fact that we made it this far says something about our strength, our faith, our determination to not let this pandemic beat us. Although we are living a new normal, whatever that means to you, I'm convinced that together we will make it through. I especially applaud parents like you and parents like me. Most of our households now serve as a temporary classroom. Our kitchens have become little restaurants that never seem to close. My children eat all day. I don't know about anybody else, but parents who are no longer working and those parents who are fortunate enough to be working out of their homes are trying to maintain a sense of normalcy, keeping their families safe and their children academically engaged. That's really, really tough, especially when you have children like my creative, funny, athletic 14-year-old son, who, by the way, has ADHD. He would much rather spend his time on video games than his math lessons. I know it's been hard assisting your children with their schoolwork. I know it's been hard. It's been tough for me. Math at the kitchen table with 3 kids in 3 different grades, different learning styles, finding a schedule that makes sense, whatever that means, teacher check-ins or no teacher check-ins at all of it is just way too much. COVID-19 has highlighted in real time all of the inequities in our school system. We see it now. Families without access to technology and internet, a lack of clarity around the plans for students with special needs, students and their families needing food daily, and the list goes on and on. We really haven't done a good job of taking care of one another. We really haven't. We haven't made sure that everyone had what they needed before this crisis. Instead, some of what we had long before the pandemic was overcrowded classrooms. We had unsafe buildings, uncertified teachers in several school districts, outdated books, lack of supplies, and you can just continue to the list. I say we use this moment as an opportunity to reset and make it right. The most valuable lessons are learned in the toughest times. And it's times like these that help us to reflect and reevaluate. And we have an opportunity to do that right now. Just last week, the courts decided on the side of Detroit students that they had a right to literacy, that the inequitable policies put in place by key leaders in our state interfered with Detroit students' opportunity to learn. Now, although the court's decision is good news, it's not over. We need Governor Whitmer to settle this case. We need her to reset and make it right. And we need you and 3 of your friends to get this message across. Now, you could take action now by texting READ 313 to 52886. Again, that's text READ to the number 52886. You will then receive a text within a few minutes, and you'll have instructions on how to connect with the governor's office and all of her social media platforms. And we will continue to remind you of this throughout the duration of the town hall. But now we're going to hear from Nkenge Browner. Nkenge.
Thank you. Good morning, everyone. I'm Nkenge Browner. I'm also the organizing director at Mothering Justice. I'm the mother of 2 DPS students who, like all of our kids, were snatched away from their support systems at school, their peer groups, their social activities, and now we're doing the best we can to homeschool them. Mothering Justice is available to help parents who need packet drop-offs for the learning packets the schools are offering. We also need you to be a warrior for Detroit students and help us defend this right to literacy by texting READ 313 to 52886. If you're watching from onedetroitpbs.org, you can text us questions to 313-288-2082. Again, that's 313-288-2082. The rules for the chat are being posted now. We are committed as a group to posting the answers to the questions that aren't answered early next week on our partner Facebooks. We'll also post a live recording of this on onedetroitpbs.org. If you would like to sign up for regular updates and get reminders from our group, please sign up by filling out the form in the chat on Facebook or texting your email to 313-288-2082. Again, that's 313-288-2082. For those of you who have just joined us, I will have Cindy, Syed, and Katie tell us again how to connect if you're a Spanish, Arabic speaker, or any ASL interpretation. Cindy, please share the number for Spanish translation.
Si necesitas traducción en español, por favor, habla al 313-626-7440. 313-626-7440.
Thank you. Syed, please share for folks who have just joined the Arabic translation.
إن كنت بحاجة للترجمة إلى اللغة العربية الرجاء الاتصال على الرقم 313-241-7030 313-241-7030 وشكرا.
And our ASL translator will let folks who need ASL translation who have just joined know where they can get that. And I will turn it over to Cindy and Jimena.
Thank you, Nkenge. The schedule of today's speakers should be posted here soon so that you can see it. And we are excited for our expert panelists that could join us today to share with us the 3 to 5 most important pieces of information that families and students need to know right now. We also have some amazing guests that will lead us in some kid activities that we can continue to do at home. For our experts, please remember to speak slowly for our translators. They really want to make sure that they're translating the important information you're sharing correctly, so please speak slowly. Also, turn off your camera when you are not speaking to ensure our ASL interpreter can be seen, and mute yourself when you're not speaking. You will have 5 minutes to share. Terry Whitfield will chat you your remaining time, and if you go over your 5 minutes, Jimena will gently remind you to wrap up. We will be taking questions from our audience at the end of each of your segments. Jimena?
Thank you, Christine, and thank you all of the parents that spoke and are such a powerful example of how we are keeping it real, vulnerable, but still staying focused on our collective power. And speaking of power and the ability to help our community, we're very excited as we move into the next segment of our program. And that's going to be focusing in on our basic needs. And we're so pleased to have two folks for us. First, coming on board from DTE will be Marifer Calleja, who is the Director for Multicultural Outreach. Welcome.
Thank you for having me. Thank you very, very much. And my name again is Marifer Calleja. I am a manager at Multicultural Outreach for DTE Energy. And again, this is a fantastic opportunity to reach your audience and remind them that DTE is here to help. So kindly, if you have any issues because of medical items or because of financial restraints, kindly call us at 1-800-477-4747. Again, it's 1-800-477-4747. This phone number would allow people to have access to and speak with a customer representative in their own language. So just the only thing they need to do is request that interpretation by phone. So we also wanted to offer some updates in regards to the State Emergency Relief Program. And on those, we just wanted to highlight that a lot of work has been done to improve and have easier access to this program. And so in order to achieve this, the State Emergency Relief Program eliminated the phone interviews. They also suspended the one-time energy programs and co-payments that usually were required to get the SER. The other good thing that we would like to remind people is that the SER is available at the first time whenever they're having any type of challenge. So there's no need for them to be in the shut-off mode. Lastly, one question that we have received is whether the SER is available for people without Social Security numbers. And what we have been able to find out is that that is indeed a possibility, and that the help is prorated based on the people in the household who actually do have a Social Security number. So thank you for having us. Those are the updates that we wanted to share with everyone today.
Thank you, Marifer. And we'll move forward in our basic needs. We're so delighted to welcome back Louis Pitzker, who is the CEO of Wayne Metro Community Action Agency. And Louis, we understand that there's some real opportunities with the stimulus funds for our families. Please share.
Well, thanks, Jimena, and thanks for having me again. I'm really glad to be back. So in an effort to respond to the immediate needs of Detroit and Wayne County residents, Wayne Metro Community Action Agency is implementing our CARES Recovery and Relief program. Wayne Metro was awarded $11 million for funding specifically earmarked for residents in need living in Wayne County, and $8 million is earmarked for the city of Detroit. So our services to as many individuals as possible over the next 90 to 120 days. So we are really gearing up to provide these services. So I want to talk really briefly about what services we can offer during this crisis and how to access these services. So First, how can CARES help? How can Wayne Metro assist you? So first, let's look at who qualifies. The qualification limits have been raised to 200% of poverty. So if you're a family of four, if you make under $52,400 a year, you're eligible for these types of services. And the other big deal to this funding is that there's something called categorical eligibility. So if you are laid off and have if you are receiving unemployment compensation from the state of Michigan, you're categorically eligible for services. If you have a child enrolled in a Head Start program, or if your child is receiving free and reduced school lunch, you're automatically eligible. If you are receiving assistance from the state of Michigan, SNAP, TANF, if you're on Medicaid, you're automatically eligible. And if you were enrolled in the RAT program, or if you were enrolled in DTE's LSP program, you're automatically eligible for these services. So now let's just talk about, what are the 6 areas of assistance, and I want to do that next. So first, if you are in need of food and income supports, we can help. We have over $2 million set aside in a partnership with Gleaners to provide food, diapers, wipes, formula, and hygiene products to families in need. We are working with 16 partner nonprofit agencies and also 30 neighborhood groups to get these food and resources to you and your families that need help. Also, water and energy assistance. We have about $3 million available for water assistance. If you are currently not enrolled in the RAT program, we can get you enrolled in that program, and we can get you an additional $250 bill credit that could help your family. Rent and mortgage assistance. If you have a past due notice, we can get you up to $1,000 of assistance to help with your rental payment. Emergency plumbing repairs to help get your water turned on. We have dollars set aside for that. Property tax assistance. And also, we know that there's been a lot of loss of life in Wayne County, and we can also help with funeral related services. So if you need to get a hold of us for any of these services, please reach out. Our call center number is 313-388-9799. Again, 313-388-9799. And you can also reach us at our website at waynemetro.org. On the call center, our hours are 9 a.m. to 7 p.m. daily, and on Saturdays from 9 to noon. Thank you. Looking forward to answering any questions anybody might have at the end of the segment. Thank you, Jimena.
Thank you, Louis. That's all great news for the Wayne County, and in particular for the city of Detroit. So I think at this point, we would love to hear if there are any questions. If you have questions, you can type them into the Facebook Live chat by texting, or you can text them to 313-288-2082. That's 313-288-2082. Christine, do we have questions for basic needs?
We do. And you can continue to post your questions in the places that Jimena just shared with you. And we also are posting a survey in the chat. If you fill it out, you'll be entered into a raffle for a $25 gift card. This question is for Louis. Do you have to have a shut-off notice from DTE to receive funds?
Notice from DTE. If you are, I would urge anyone to call the 313-388-9799 number. So if you are choosing between food and keeping your power on, you need to call us, and we have funds available to get you some utility assistance outside of the normal DTE programming. That's what these funds are for. This is above and beyond any type of assistance you can get directly from DTE. So if you don't have a shut-off notice, but you feel you're going to be getting into some trouble, please reach out and call us.
Louis, this is for you as well. do you need a social security number to access the services at Wayne Metro?
No, please call us and we can look at other forms of identification to get you eligible for services.
Great. And then, so another question regarding getting services, are there multilingual lines available at Wayne Metro?
Yes, you can access multilingual lines two ways. First, you can go to our website. The website also has a chat feature and you can do an online application if you don't want to wait online. The website can be converted into 4 languages, Arabic, Spanish, I believe Bengali, and Hmong. It's on our website. And then if you call our call center, we can do multiple languages on our call center. So there should not be a language barrier at all for families to access services from Wayne Metro.
That is wonderful to hear, Louis. And then there's one very specific question for a specific church. It doesn't name the church, but would Wayne Metro support our church with a community food pantry? So are you doing any partnering like that with churches? Yeah, we are. We are. I would definitely, Jerome, I think Jerome Drain is on the line, and you know what? Yeah, call our call center, call the 313-388-9799 number, or if you can somehow get me that person's contact information, if you can get that to Jimena can get it over to me, and then we can reach back out. So the short answer to that is yes, we are looking for community-based partners to assist with food distribution. Great, Louis, I'm going to try to get that person's contact information. We have 2 more questions. What if you already had services with Wayne Metro programs and still live 150% in, I think, above the poverty line? So it sounds like if you're, Okay, so I think if I'm understanding this question, it's like, what if you've already received services from us, and if you're maybe, the threshold has increased to 200% of poverty. So if you already have received some services from us, it doesn't stop you from receiving other services in other areas of need. So if you've received services from us for, let's say, water or energy, but you're having issues with your property taxes, or you're receiving some property tax assistance, but now you need assistance with food or energy, it doesn't matter. Just call us. One is not conditioned on the other. And because you've received one set of services from us, it doesn't stop you from getting other services. So my best answer to that is call, let us know what your issue is, and we'll do our best to get it resolved. And if you're under those income thresholds, or if you meet some of those categorical eligibility criteria that I talked about, such as you have a child in Head Start, you're going to be eligible for those services. So the best thing to do is call or send us a chat, and we can get your question answered. Great. And then someone wants to know how they can become a volunteer. Oh, that is great. Well, we need volunteers. I would add the same number, that 313-388-9799 number that's on the screen. That goes to our call center. So that can also handle services, questions, eligibility questions for services, or if you want to volunteer, you can do it through that number also, and we can hook you up with, we could definitely put you to work, put it that way. We have a lot of need. Great, Louis. Thank you so much. And thank you, Marifer, for being with us today. That's all the questions that we have. Louis will try to get the person's name so that we can connect you all. But thank you so much. Jimena? Well, thank you. Thank you both.
No, and thank you. And what I love, and I hope the folks out in our audience know, and Louis, actually, you said it, we want to hook you up with resources that you can use right now to make a difference for your family. So please move quickly. As we know, with many of the stimulus funds, when those dollars are gone, they're gone. So let's work hard to make sure that the families who need it can get those resources. But as we're talking about basic needs, of course, we have to talk about health. our health, both in terms of our physical health, our mental health, and our overall well-being. This week, we're particularly excited that our health focus will be on maternal and infant care, because we realize that COVID is scary by itself. But think about how that is affecting women who are pregnant and those families. And what does that mean in terms of breastfeeding? What does it mean in terms of our infants and our toddlers? So to help us better understand the information, knowledge, and resources that can help both our pregnant families and those of young children, we're really pleased to have three folks who have a huge amount of expertise in this area. First, we'd like to bring on Dr. Richard Bryce, who's the Chief Medical Officer at Chaz Medical Clinic. Dr. Bryce, welcome.
Hey, thank you so much for having me today. I really appreciate it. I know right now it's pretty hard. Everyone is separated, and I think this is an awesome way to kind of feel unified with those in the community. So I'm feel very honored to speak with you guys today. As was stated before, I'm the Chief Medical Officer at the Community Health and Social Services Center, or Chaz, and that's in Southwest Detroit. I am a family physician by training as well, and at Chaz we do see a lot of prenatal or women that are pregnant, and so we do a lot of prenatal care. We do have a long relationship with Henry Ford Hospital, and so fortunately I did get some questions in advance that maybe I can answer, and of course any other questions. So I was able to kind of consult with some of my colleagues at Henry Ford as well for anything I didn't know. So once again, I just appreciate being here as well. I can tell you that at Henry Ford specifically, the one question I got was, let's say that due to COVID, are you allowed to have any visitors? Are you allowed to have anyone with you during the delivery? What about translators? And so Henry Ford's policy right now is limiting the amount of visitors that you do have, but each person is allowed to have one support person, as well as if you needed a translator or a doula, you wouldn't be able to have that person. You could have up to two people. And of course, that's difficult, but that is the way of trying to limit exposure to those with COVID-19 as well. One question was, hey, can COVID-19 or the coronavirus be transmitted through birth or through breast milk? You know, the tough thing right now is, and many of you probably are aware, there's a lot of things that we don't know. Fortunately, from the data that we understand now, in terms of the coronavirus in the pediatric population or neonatal population, it doesn't seem to be as detrimental as some of the other infectious diseases, specifically like the flu. So that's a positive, but at the same time, with cases that I'm aware of at Henry Ford and through Chaz, if a woman does get the coronavirus, this is still a very serious thing. And so we want to prevent any transmission that we possibly can. And so I know at Henry Ford, there's been women that have delivered babies when they were positive for coronavirus. There's actually been some women that have been intubated, that have had to get C-sections due to the coronavirus. Fortunately, all of the outcomes that I'm aware of have been positive. But this is still, a challenge that we need to try to prevent the best that we can. And so, the recommendations that everyone is hearing, whether that's social distancing, washing your hands, wearing masks, these are all things that if you were pregnant, I would definitely recommend for you as well. And then another question was in terms of support for women postpartum. I think all of the same supports that are out there clinically from us at Chaz, we are continuing to practice. I can tell you, we find at Chaz right now, we are doing essential visits. So we are doing a lot of virtual visits and telephone visits, but we consider prenatal care to be essential and postpartum care to be essential. And so we are still seeing our women for their prenatal care and postpartum care because, there may be some women that are low risk, but we find that low risk can change at any time, and we need to be very aware of when that could occur. And so we are doing that. I would like to mention one last thing as well, is that Chaz, to support our community, because unfortunately in Southwest Detroit, we have had less testing than in other parts of the city. We are starting to do drive testing. So if anyone is interested in getting tested, if you're a Chaz patient or you live in 48209, 48210, or 48216, please call Chaz at 313-849-3920 to get signed up for a appointment time to get tested. So I'd love to see if there's any questions, but thank you once again for having me talk with you.
Yes, Dr. Bryce, and thank you. We are going to have an opportunity for questions after this segment. You gave a lot of very important information, and particularly when you raised the issue about essential work. Many people think that all of the health clinics are closed. So these are good myths to bust. But speaking of busting myths around health, we're really glad to have our health department with us. And specifically, I'm delighted to have Shirley Gray, who is the director for the Sister Friends program at Department of Health, but also to share any other insights about the array of maternal and infant care that's available. Shirley, welcome.
Thank you all for having me. I'm happy to join you in this great conversation and providing a wealth of information. Jimena, I think I sent a slide, one slide. I don't know if we can put it up with all the contact information.
Sure. I think in the background, Molly is trying to bring that up. And if by chance we can't get it up during the time of your presentation, we'll make sure it's available to the audience.
Thank you.
Mm-hmm. There it is.
Thank you. Thank you so much. Sister Friends Detroit, it have been in operation for about 3 years. And we started as a way of looking at infant mortality. We're all aware in terms of the infant mortality rate in the city of Detroit, which have doubled the rate of the state of Michigan. So Sister Friends Detroit was developed as an initiative with the Detroit Health Department to address barriers to care for women that are pregnant and live in the city of Detroit. We was looking at some of the reasons why our infant mortality rate was so high, and it relates to the quality of the prenatal care, social isolation, environmental stresses that causes our babies to be born too early or at too low of a birth weight. So as a result, we modeled after a program that's an international program that is in 96 different chapters that is looking at how do we work with pregnant women differently. So what we have done is we recruit Sister Friends, who is a mentor, and that mentor is trained and is matched with a pregnant woman. We are trying to we recruit women as soon as they know they're pregnant, and we match them with a mentor. And that mentor is a person like you and I that have time, have compassion, and really want to be assistant to another person, particularly a pregnant woman who may be having stressors and need that additional support. We understand even now how important it is and how difficult it is to be in social isolation, because with COVID-19, we are really experiencing even more isolation than we did prior. So that's why this program is even more important, that we reach out to our pregnant mothers and families to make sure that they have resources. So what we are actually doing is recruiting volunteers, training those volunteers who provide emotional support and help these mothers to break down barriers to resources, making sure that they have somebody to call. This program provides resources and support. We provide education and enrichment classes, and all of these classes used to be face-to-face, but of course, in COVID-19, we are all virtual. The mothers are assigned to a community health worker that walks them through the entire pregnancy up until the child is a year old. For those situations where there's complex needs outside of community health worker, we have 2 social workers that are assigned. We provide lift services to all of their prenatal appointments and the enrichment classes that we offer. This program is free to any woman living in the city of Detroit. And the only requirement is that she's pregnant and she wants to be involved. If you are pregnant, or if you are a volunteer that wants to become a mentor to a pregnant woman, we ask you to call 961-BABY. Or if you just need resources in general, if you are not pregnant, but you need resources in general for your family, call 961-BABY. We are there to assist you. And again, all our programs is now virtual. And I will stop there to see if there's any questions after this segment.
Thank you so much, Shirley. I'm sure that we will have some questions, but I'd like to go ahead and welcome Kadada Green, who's the CEO of Black Mothers Breastfeeding, to talk to some more about the impact and need for breastfeeding and what some of those social determinants of health that may be interfering in how we make a difference in this time period. Kadada, welcome.
Well, thank you, Jimena, and thank you all for having me. I'm very excited to be here to talk to you amongst this esteemed panel. As Jimena mentioned, I am Kadada Green, the founding executive director of Black Mothers Breastfeeding Association, where our mission is to reduce racial inequities in breastfeeding support for Black families. And we do that in three ways: through direct service, through advocacy, and through training and education. And really around COVID-19, we want to ensure that families establish and maintain breastfeeding both at home and right after delivery in the hospital. According to the World Health Organization and the Center for Disease Control, there is no evidence that suggests that COVID-19 is in breast milk. So to date, it has not been found in breast milk according to our resources. It's also important that we that families who have been exposed and delivering moms who have been exposed to COVID-19 practice respiratory hygiene and hand hygiene when they're in the hospitals. We want to make sure that babies and mothers have limited separation when at all possible. And there are protocols that hospitals can put in place. The Center for Disease Control suggests that informed decision-making is made and that those decisions are left to the families when families are have had some exposure to COVID-19. So there are precautions that can be made when a mother wants to breastfeed and has been exposed, whether that's hand hygiene or respiratory health by covering one's face and one's mouth. We know that during an emergency, breastfeeding is the most reliable and safest form of infant feeding. We've had examples of this. Throughout Katrina, there were tragedies where families could not get to infant formula and breastfeeding behaviors had not been established. And we lost children because there was no infant feeding method available to them. Right now, during COVID-19, we are overwhelmed by the amount of empty and barren shelves that we see when we go into the stores. And we want to be sure that families know that breast milk is safe and that it's a reliable infant feeding method. And we just really believe that we need to do what we can to reduce harm. And we understand that there is no evidence that suggests that COVID-19 can be found in breastfeeding. We have some resources that we can support you with. I'm going to say this phone number a few times. We have a warm line. It's 1-800-313-6141. If you call that warm line and you need support with breastfeeding, we're there to help you. If we have community-based doulas who are well-trained and experienced to support mothers who are pregnant, mothers who are delivering, or mothers who are early postpartum. Make sure that you call us for the support that you need. We also provide virtual Black Mothers Breastfeeding Club, which is our virtual edition of our signature work, which had actually run without interruption for about 12 years until COVID-19. And you can text BMBFA to 82257. BMBFA to 82257, and we'll send you information on how to be a part of our virtual Black Mothers Breastfeeding Club, or you can find us in our Facebook group, Black Mothers Breastfeeding Club of Detroit. Again, our warm lines for breastfeeding support, for pregnancy support, or for early postpartum support, that number is 1-800-313-6141. Be sure that you really understand that we are in a state of emergency and that we need our babies to survive and thrive. And that breast milk is the safest and most reliable form of infant feeding during an emergency. Thank you so much for having me here today. I'm happy to stay around for questions.
And we're happy to have you, Kadada. Thank you so much for reminding us that mommy's milk is best. So what we'd like to be able to do is go into a segment to hear what kind of questions. A reminder to the audience again, if you would like to get some more information, you can text to 313-288-2082. That again, to submit a question, text 313-288-2082, or you can put your questions in the Facebook chat. Christine, do we have questions for our health experts?
We do. And just a reminder that we are posting a survey in the chat right now. Please fill it out, and if you do, you'll be entered into a raffle for a $25 gift card. So, Dr. Bryce, could you repeat the phone number that folks should call for testing?
Yes, it is 313-849-3920.
Thank you, Dr. Bryce. And we are so excited that we are going to have testing in Southwest Detroit. So thank you to Chaz. Also, there was a comment from the audience that says, I am a sister friend. It's an amazing program. I just spoke with my little sister. Please volunteer. So a little plug for sister friends from the audience.
Thank you so much.
And those are all the questions that we have at this time.
And so one of the other people, thank you so much. Again, this was really so important. This is a population that's often been not thought about in this COVID crisis as we address the dynamics of these health and racial disparities. But we also, some of you may be interested in what are some of the data right now in terms of the number of people who are being tested throughout the city and the rate of infection, et cetera. We would love it if Crystal Hepburn, who has been visiting us consistently from the Detroit Health Department, could come on and share any more recent data with us in regard to COVID. Crystal, if you are with us, please come on board.
Hi, good afternoon. Thank you so much for having me. I do appreciate always being involved in this. Just a few updates. We want to go ahead and make sure that everyone is aware that we still need to go ahead and be very stringent about the precautions that we're taking, continuing with our hand hygiene, hand washing, making sure that every time it is now mandatory when you leave your home that you do wear a mask, because we are trying to go ahead and still continue to stop the spread and the risk of perhaps passing this virus on. We would like to go ahead and see our numbers come down for sure, because at the moment, locally in Detroit, as of this morning, we have 8,954 positive cases, which is wonderful. That means we're doing a lot of testing and everything. However, unfortunately, we have had 1,008 deaths. These are deaths of loved ones. These could possibly be deaths that would be associated with asymptomatic individuals visiting or seeing others in the community, especially early on. So oftentimes people don't even know that they are carrying the particular virus. So having the mask on each and every time you leave your home, whether it be for grocery visits, pharmacy visits, or your daily exercise, can possibly minimize the transmission from somebody who is carrying the virus but not showing signs and symptoms, as well as it would protect an individual who is sharing, who is actively with the particular virus from going ahead and spreading it to any others that are not currently carrying the virus. We want to make sure that individuals continue to keep their social distancing of at least 6 feet apart. I know many stores have gone ahead and put the notices or the distances of 6 feet on the floors, perhaps with tape or other methods like that. That's wonderful. We want to continue with that. We want to make sure that cleaning and disinfecting all surfaces still continue. Think about those surfaces like your light switches, elevator buttons, your door handles for sure, your cell phones, anything that you touch frequently should be disinfected. As of April 20th, the city of Detroit has offered complimentary testing for individuals with essential businesses. In the city of Detroit, essential businesses can now call 313-230-0505. They would be able to register their business. They would obtain a unique code. Once the city verifies that they are an essential business and providing essential services, they will receive a phone call back with identification that that unique code has been activated. Then the employees, as well as the business owner, would be able to make appointments still by calling 313-570-4983 for themselves at the Michigan State Fairground. Testing for essential employees will not require a doctor's order. So that is a wonderful opportunity for a lot of businesses to ensure that their employees get tested. Please, please make sure that you do register today. For regular residents in the city that do not participate in essential businesses, the guidelines still remain. A prescription from the doctor is required prior to making your appointment on the appointment line as noted. Individuals that speak Spanish and Arabic, please be aware that there is a translator on site as well as access on the appointment line. Any other language is available through a translation service for individuals to call and communicate, to book your appointment, or to speak to somebody at the state fairgrounds. There is over 300 languages available to representatives of the city of Detroit. So please, please call and get tested. Thank you very much.
Crystal, thank you, and thank you for the information about the expansion of testing for essential workers. We've known and seen the disproportionate number of our families that are being impacted who have folks who are bus drivers or who may be custodians. This is a population just like our seniors and all of us that we need to protect. Thank you to the health department and to all of our health practitioners and the people who help the system go to help keep us safe.
Jimena,
Yes.
I'm sorry, this is Shirley. Let me just mention, although our WIC physical office is closed at the Detroit Health Department, WIC is still available virtual.
Okay.
If I call in 313-364-9407, or you can text 313-246-2866. And we encourage everybody, every family that need WIC or should be enrolled in WIC, they can still enroll in WIC services.
Excellent. The Women, Infants, and Children program is a vital resource to keep pregnant women and our infants and babies well. Thank you so much. Before we transition, I'm seeing you, Christine. Is there a question or something we need to add?
There is. Thanks, Jimena. We have one question for Crystal. Crystal, is there a public list of which businesses have registered for free testing for the employees?
Marley, why I'm doing this?
Hi, good afternoon. Thank you so much for the question. I do not have access to a list for the essential businesses that have been registered. If individuals have not received a unique code from their business owner or manager, I would definitely ask that business owner or manager to go ahead and register. That's the only way we would be able to identify that they have registered or that employees have the access for the testing is if they have the unique code.
And is there a public list of those businesses that have registered?
Oh, am I on mute? No, I don't have a public list at the moment. There may be one coming out shortly. I can't guarantee it. I can definitely go ahead and bring it up and suggest it being available, but at the moment, I don't have access to a list.
Thank you, Crystal.
Thank you.
Well set, Jimena. Thank you.
Okay, thank you, all of you, and thank you for lifting up infant mortality, which is one of the outstanding health disparities that continues to affect our community, not to mention maternal deaths, disproportionate again amongst African American and increasingly now even Chicano and other families. So health, where again, knowledge is power. And speaking of power, we also want to make sure that we are empowering parents to have an array of activities that you can do with your children. So we're now building into our program every week. We're going to have our cultural institutions come forward to share activities and ideas and virtual trips. So we're really excited to have the Executive Director of Marketing from the Detroit Institute of Arts, DIA, Christine Klustra, is joining us this morning. Welcome, Christine. Christine, are you with us? Or some technical difficulties? Okay, so what we probably will do then, just to move forward, Christine, while you're putting those items together, we're going to continue to move into our next segment, which is really a very special segment. And that is, as you heard earlier, the name of our coalition is the COVID313 Community Coalition of Families and Youth. So we're so pleased to be able to have some of our youth activists to be part of this next segment. We're going to bring up Ellie Vasquez and Malachi Mason, Ellie attends Cass Tech, and Malachi attends the Benjamin Carson High School. Both of them are active or young organizers and focus on educational justice and working with 482 Forward, Congress of Communities, and the Northeast Education Action Team. Today, both of them will be asking questions of our educational experts. We're so proud of you, and we're ready to hear you ask questions of our educational experts. Ellie, as well as Malachi, welcome.
Hello, my name is Ellie Vasquez, and my pronouns are she, her, hers. And like she said, I am a student at DPSCD.
Hi, my name is Malachi Mason, and I'm also a student of DPSCD.
Ladies, I'm so sorry. We had the wrong person for the DIA, and Salvador is actually on. So thank you for introducing yourselves. You just get to introduce yourselves in a few more minutes. So if you'll turn your cameras back off, and then if we can welcome Salvador from the DIA. Salvador?
Hello.
Hi, how are you?
Well, sorry, we had a little bit of a glitch here with the video.
We can see you and hear you now. Go ahead, Salvador. Thank you for joining us.
Thanks for including us today. And I want to say hello in Spanish to my Spanish friends in Southwest Detroit. Hola, amigos, ¿cómo estáis? Vamos a celebrar el 5 de mayo juntos. And I just want to let everybody know that we're going to participate in a virtual desfile el día del 5 de mayo. And the DIA is preparing a couple of videos featuring our Diego Rivera murals and also Frida Kahlo. So I'm just very excited about that, to be part of this celebration. You know, the museum is very focused on serving our community. We have free admission for all the residents of Oklahoma and Macomb County. We bring every year 90,000 students to the museum. We bring seniors. We have a number of community partnership programs in the community, and we do murals and a number of things. Unfortunately, as you all know, we are now closed, so we have shifted our work on our website. So there's a lot of wonderful opportunities online at the DI.org. So there's a number of activities for parents and children that include our making, writing prompts, and more. We're also providing activities for seniors. And next week, we're going to be distributing a number of activities like weekly art talks in the Thursday afternoons. One of the things that we are doing as well is participating or trying to help the individuals who don't have access to internet, and we have partnered with Forgotten Harvest, and as they distribute meals at the DIA parking lot, each meal is accompanied with a number of a page with things that the kids can do at home in terms of different activities. Also, yesterday we started a series that we are playing in Facebook, and I am going to be reading books for children every Wednesday at 11 a.m. Yesterday, we read a book on Frida Kahlo and Her Animalitos. Next Wednesday at 11 a.m., I will be reading a book for children on the life of Diego Rivera. So, we are really trying to help everyone with their lives at home, and we're thinking about the parents and how they are handling their schooling for their children, and we want to participate on that as well. Our teachers in the museum are preparing a number of videos that we're going to be distributing very soon, and that people will have the opportunity to access online as well, where we explain different activities as are making, as I was mentioning at the beginning, but also we have our art teachers talking about the collection and the different activities that the kids normally do when they come to the DIA. I'm also very excited because every year, as you know, we collaborate with Detroit Public School Community District. We have this long partnership with them. For 83 years, we have been organizing this student exhibition. The K-12 students make different works of art that we show in our galleries, and we have a big celebration in the museum in April. The parents come, and we have presentations in the lecture hall. Unfortunately, this year we won't be able to do that because the museum is closed, but we're going to have all these works of art accessible online on our website. So we're going to do a smaller exhibition. It will have an introductory video in which I will be speaking, and then some of the students will be interviewed. And it's just great to see that our students have this amazing talent. They are the artists of the future. We want them to know that we want to feature them immediately as they are very young in their museum, the Detroit Institute of Art. So please visit our website. We have a number of activities for all of you, and we will be adding many more in the coming weeks. So I hope you will, and I hope all of you stay safe and healthy.
Salvador, thank you so much. And we're so pleased that you were able to navigate back with us from out in cyberspace. It keeps happening to us. And that's why we're sticking with it. And I have to just say that how much at Detroit Parent Network, we love doing the virtual tours. We're starting to do that now, DIA. And we encourage all of our families to begin to take a look at the gems of cultural institutions that we have. So we're going to go ahead and move forward. Again, Salvador, thank you so much. And we'll make sure that those telephone numbers are available to our audience. I'm going to now kick it back to Ellie and to Malachi for our educational segment.
All right. Once again, my name's Ellie.
My name is Malachi.
And today we're going to interview charter and DPSCD leaders about learning plans. We'll do this for 20 minutes, then bring up the director of Hope Starts Here, Denise Smith, to discuss early childhood.
Our first question about distinct learning plans, which are plans for how the students will be able to finish out the rest of the school year. Ms. Wright, can you please introduce yourself and tell us how the direct plan was determined and what students and families need to know about it?
Okay, I'm trying to get my camera working, but hello, my name is Etta Wright, and I am the Deputy Superintendent of Schools with Detroit Public Schools Community District. And so it's asking me, just for the record, it's asking me to start my video, and then it's telling me that I can't. So I'll just keep talking, and we'll try to get that set up. I am the Deputy Superintendent of Schools of Detroit Public Schools Community District. And in terms of our learning plans, our distance learning plans, we did start our rollout actually last week with students. We did packet pick up on Wednesday. We have full access to all of the resources online as well. And we also have videos that are already prepared where teachers are teaching the lessons, and then they have live check-in opportunities also. So we really look at 3 different ways to communicate with students. One of them would be for those that have only the access to packets. The other would be students that have access to the telephone, but they may not have access to technology. And then the third, of course, would be students that have access to all technology. So we want to ensure that all students are able to interact with our learning opportunities as well as with their teachers and our support staff. We're also providing support to students by calling them on the telephone. We have our support staff that are talking to them. We have them that they're doing tutoring with them over the phone as well. So every opportunity possible to touch our students and families, we're looking to do that.
Thank you. Rashadri, can you introduce yourself and address the learning plans for charter schools in Detroit and what's most important for students and families to know?
Sure. Hi, good afternoon, everyone. Thanks for the opportunity to be here. I'm Rajeshri Bhatia. I'm the Director of Detroit Operations for Grand Valley State University's Charter School Office, which essentially means I provide support and leadership to the schools in Detroit and Metro Detroit. More importantly, I'm a former teacher and school principal, so I kind of always consider myself a student and teacher and family advocate, even in my administrative roles. Charter schools have been prioritizing learning at the best possible level given the circumstances, and we know that it starts first and foremost by connecting with students and families and assuring their health and well-being. We're working to address technology gaps and understanding just what life is like for our students and families right now so that we can best serve your needs. Each charter school's plan is actually tailored to its students and its teachers and its families. The most important thing for you to know is that every plan should be different to meet the different needs of families. Some plans rely heavily on online access and online programming. However, some also are using paper, pencil, workbooks, and telephone. They've been designed by the Detroit charter teachers, the Detroit charter principals, and the others who work in the schools to meet the needs of their students. The reason that many families actually choose charters is because they provide the small family environment, and every school is different in how they do this. I think when you look at the diversity of the learning plans, this sort of nurturing sort of diversity is also reflected. You can find your school's learning plan on the school's website. When you look at it, you'll see the various ways that your school is continuing learning in this time, and very similar to what's already been described: online sort of interactions, packets, telephone calls, etc. What's really important is that students and families stay engaged at this time. We know that this is different, and we know that this is hard, and this is super overwhelming for everyone. We get it. And I think that if something isn't working, connect with your teachers, connect with the school, let us know this so that we can help find a way to make it work for you. Because we don't want you to just stop learning. That's the important piece of all this, is we really want learning to continue, and we want to do what we can to help support it.
Thank you both. Ms. Wright, I interviewed Dr. Fetty about a month ago when we first heard the announcement that schools were closing. We are still getting lots of questions about what exactly is mandatory for students through the rest of the year regarding attendance and assignments, and how these things will impact their grades, or if they will receive other types of consequences. Can you clarify?
Absolutely. So we did add to our web page a full frequently asked questions list that really was a part of it, was born out of some of the questions that the team asked to Dr. Fetty during one of those conversations. So as we're moving through the rest of the year, on April 20th, all grades were due in the system for students. And for students that were passing as of the last day of school, which was March the 11th, then those students, if they had an A, B, C, or D, for the third quarter, they would receive a passing score, which would also mean that they would pass for the semester. So if up until the time of closure, if students were passing, then we absolutely do not want them penalized for that time. If students were not passing at that time, but teachers do believe that with more opportunity for the quarter, they would have passed, and teachers did have the opportunity to give those students a passing score as well. For students that were not being successful when school closed, they have the work that they're doing right now is enrichment for everyone else, which means that it's not impacting their grades. But for students that were not being academically successful, it can impact their grade, and it can get them to a passing score. So in terms of grade point averages for the first semester, that would be the student's grade point average for the rest of the year. But in terms of students getting credits for the classes that they're in, and for our high school students, or students being able to pass, if they were passing pre-closure, then they are still passing now. So the work that they're doing is highly recommended. We're encouraging families to engage with it, but it is not required, and it does not impact their grade if they were already passing.
Thank you. Rajeshri, can you tell us how charter schools in Detroit are handling grades, attendance, their consequences, their assignments, and things like that?
Sure. Again, each school is going to handle grades differently. And if you look at your school's learning plan on the website, it's going to be listed there. But we're handling things differently, just like every teacher grades a bit differently when we're in normal in-person instruction. Governor Whitmer made it really clear that students should not be penalized during this time period, and that schools need to make a good faith effort to ensure that students are learning. We know that learning remotely and learning at home is very different than learning at school. And it's not just about attending for a certain number of hours or completing a few assignments. It really is about learning. We're seeing that teachers who design these plans, they know that some students will move through curriculum at different paces. They know that different students have different needs. So you'll see things, different strategies. Every school will have a different way to track learning and provide feedback. And that's the important piece also, is that it's not just about turning stuff in or sort of being there to watch a video or be in a lesson. It's also about getting feedback from your teachers, just like you would in normal school. Specifically, and again, because there's such a wide variety of ways schools are doing this, I'll just share some examples from schools that I've talked to over the last few weeks. Some charters have frozen grade books, and students will earn the grade they had as of March 12th. But students do also have the opportunity to improve their grades by continuing to participate and submit work. Some high schools will not be giving grades for the term. They'll be awarding credit or assigning incomplete. And students will have the opportunity to earn the credit if they got an incomplete throughout the summer or into the fall with help from their teachers. So in those cases, there would not be a grade assigned. It would just be credit or incomplete with an opportunity to earn the credit. Others are using points, to sort of give feedback on work and participation. And in all cases, like was described already, students have the opportunity to continually raise their grades. So you can't fall back, but you do have an opportunity to raise your grades. And schools are really trying to stay as consistent as possible with systems and tools that they were using before the closure. So we're trying not to throw too much new stuff at you. Teachers are engaging with students throughout the week, either online or by telephone, both to teach and to do wellness checks, which also factors into participation. And honestly is a very important way that schools are getting feedback about how we can better meet students and families' needs. At the end of the day, students can't be penalized for not doing work at this time, no matter what the reason. But it's to a student's advantage to engage in whatever ways you can. In most cases, you can actually raise your grade, but more importantly, you'll be more prepared and ready for the challenges of your next grade. And as I said already, I'm going to repeat it again. If it's not working for you or your family for any reason, don't give up. Parents, this applies to you too. We appreciate all that you're doing at home, and we know how hard it is, and we want to support you. Connect with your teachers and see what can be done to help fix whatever issues you might be having, because they all want to support you and help you succeed.
Thank you. Ms. Wright, last week, Dr. Vitti announced that DPSCD is receiving funds for laptops for students in the district. Do you have any updates, and can you give us a timeline, and how is the district handling technology access in the meantime?
Great question. Thank you so much. We're really excited about the work that's happening through Connected Futures. And so that announcement was made last week. In June, the ordering has started for the devices. So in June, we are anticipating that the devices would actually be here. They would be distributed to our students that were enrolled in school in February, which would be our count period for that time. Students that are K through 12th grade. We are still determining, we're looking at two options for delivering them to families. So whether or not the families would come to a location and pick them up, or whether they would be mailed to parents' homes. So we're looking at those two options. So we really haven't decided yet whether it would be pick up with appropriate social distancing or if they would be sent directly to homes. But the unique thing about the devices, we believe, is they belong to the families. And so once they come in and they receive the devices, they become a part of the family, and the family has access to utilize the device and actually keep the devices. In the interim, we are giving students opportunities just based on what we just discussed. So we've not issued devices to students at this time. So students that have computers or they have access to a smartphone, most of our programs work whether it's on a computer or on a smart device, so Apple or an Android device. Or we've also provided paper pencil packets as well. And so that's how we're working with it up until this time. We do have a lot of web-based resources that families can use, but we've not issued devices to them. We're really excited about the opportunity, though, to issue them starting in June.
Thank you. Ms. Rajeshi, can you tell us about how charter schools are doing the same with technology and accessibility?
Absolutely. We know that there's a connectivity and tech gap and device gap, and charters are working to close that gap. There isn't a perfect solution here, but we do know that we're working on it every day. From talking to all the schools that I've talked to, each of our schools is trying to address technology needs by giving out the tech that they currently have available, and typically based on the level of needs. For instance, many schools surveyed their families about food resources, and at that same time, they also surveyed their families about tech when the closures were first announced. And as they heard back from families, they prioritized needs at many schools based on the families' responses. At some schools, students already had tech devices assigned to them, but when that wasn't the case, a majority of our schools then assigned whatever tech they had on hand to students with prioritizing those with specialized needs, high school students, and others. Additionally, within the Grand Valley portfolio, I know that some of our schools use some grant funding to secure devices for some students. Many of our other authorizer colleagues and charter leaders and state associations are trying to also work together, help to solve for the technology and Wi-Fi gap. I'll give it a second. Okay. We're truly very excited to see the business leaders and nonprofits come together to support DPSCD in the way that they have. And we welcome any level of support that could be extended to the 20,000 plus students that we estimate there is that have needs to cover all public school students here in Detroit. As a student, if you are in a charter school and you have a need for technology, I recommend you first contact your teachers and your schools to find out what, if anything, they have available. If they have something, they'll give it to you. And if they don't, it's important data for us to have so that we can truly assess the needs that are out there and continue to work to meet those needs.
Thank you both for joining us today. In the near future, we'd like to talk more about how next year will look. Would you be willing to join us again?
Absolutely. If you guys promise to be here, well, I'll be here. No problem.
Absolutely. Absolutely.
And Christine, do we have time for any more questions about schools today?
Well, Terry has not texted me to tell me that we don't. So I am going to take the privilege to go and ask some questions that have been asked. Thanks, Ellie. Okay. So what are schools doing to prepare for next year? How are you all prioritizing safety? Renetta, do you want to go first since you're off? Well, I think you're off mute.
I think I am. Okay. I think I am. So thank you for asking the question. I know that is something that is on all of our minds daily. Right now, we are having conversations around changes that may need to happen for next school year, not really knowing yet what's happening with shelter and stay. We're planning for looking at how we reduce the number of students that are in classrooms, or how we reduce the number of students that are in a school in the run of a day. We've started our think tank opportunities with our administrators and just having dialogue with them around what that overall safety looks like. You know, what happens with testing, what's happening with the type of PPE that's available at schools, what's happening with sanitizing, how are we looking at something as simple as students using the water fountain, and what the requirements are for that. So it really is something that's top of mind that we are talking about daily, so that when we are ready to make the decision, or when we know what decision is going to be made, we will be ready to move into implementation.
Great, thank you. Rishi?
Yeah, I agree with everything she just said. I think we're approaching it very similarly. I think what we're also trying to do is, given that our schools are unique in and of themselves, also is trying to work with them to figure out what creative solutions we can come up with based on what schools' resources and needs the schools have. I think the other piece is that we're really using this time period and kind of how these learning plans are working, or in some places not working, to gather some information and utilize the information that we're learning to make better choices for the fall. So, but again, a lot of it is going to be dependent on, what happens and what we are allowed and able to do.
Great, thank you. This question is for DPSCD. So Renetta, the technology is it one per family or one per student? And if one per family, do you have any suggestions on how parents with multiple students can navigate that situation? Multiple students, multiple grades. Do you have any suggestions?
Yes, so it is one per family. And so with parents that have multiple children in the household, it will take some organizing and planning, looking at if you're looking at pre-recorded activities, organizing the time of who would do that first versus who would do it after the fact. If you're doing blended learning activities, having options for when you sign on versus when you're not signing on, working specifically with teachers around different call-in times. So if teachers are doing live sessions, but one parent is doing a session or a child is doing a session with another teacher, really working with your teachers and planning around that. Teachers are willing to have conversations with students during their live times, and they're scheduling with them where they're talking to them after that time. So I really think just being thoughtful about the fact that this is the landscape. We have the device, which is a positive, and now how are we going to make sure that it becomes a positive for our family? And it's going to take a little bit of organization and planning. And we're willing to help with that, but it will take some organization and planning.
Great, thank you. And then this question, I have two questions that are for both of you. I'm going to ask the one that I think is on a lot of folks' minds as we get closer to June. And you probably can anticipate what it is. Will there be any opportunity to recognize graduating seniors?
Yeah, so I guess I'll start. As the mother of a graduating senior, this is a unique time, and it's challenging for seniors. And so we are looking at every possible way that we can start showing them love now. That's what we've really been talking to schools about, and how we are able to show them love. And so we're not positive yet. We're still open to having what would be a formal graduation in July if the stay-at-home orders have been removed, and looking at social distancing. But if not, we've really had a lot of conversation around also around virtual opportunities and what virtual would look like. We've engaged our student leaders around their thoughts, and really they want an opportunity to come together. And so our goal, as long as we are within the social distancing requirements, would be to give a way to do that, whether that means splitting a graduation, or whether it means not having as many students that are there at one time, but really working with them and getting their feedback on what that would look like. And I do have a correction. There has been an update for the tablets. It is one per student. So that entire issue has been resolved. That was something that we heard quite a bit, and it is actually one per student. So I do correct that.
That is great news, Renata. I just want to repeat that
Yes.
DPS-3D will be giving technology one device per student. That's great news. Radrishi, could you talk a little bit about what charter schools are doing for seniors?
Yeah, I think echoing what Ms. Wright said, it's something that weighs heavily on all of our minds. And I think very similarly, we're also charter schools are individually trying to find ways to honor these students and give them the send-off that they've been expecting for the entire duration of their academic career. I think what will end up happening is, again, because each charter operates independently, and in many cases our graduating classes are a little bit smaller, I think you will see some creative solutions come out of the charter world. From talking to principals, they too are working with their student leaders and with families to see what sort of celebration we're able to do, and that would be relevant and meaningful to the students. So I'm hoping that we have some more specifics soon. I think everybody was hoping that something would change, around now. And now that we're realizing that that's not going to happen, I think we're all sort of working towards alternative solutions. But it is most definitely something that has been on everyone's mind, and it comes up in almost every conversation that we have with schools. So it's definitely important to all of us as well.
Great. We are out of time for questions. There are questions about summer school and IEPs and counseling, but we will make sure that we get those to the two of you so that you all can answer those questions, and we'll be posting them on onepbs.org. Jimena?
Yes, thank you so much, Christine, and thank you, Ironetta and Rajeshri as well. This is important to all of us, and as those seniors are talking about, we all want to stay connected, but we know we have to do it in a safe and healthy way. But speaking of health and safety, the health and safety of our youngest children is so important. So we're going to make sure that in our education segment, that we're also hearing from early childhood and early education, so that we have a continuum of looking at the development of our children. And to help us have that frame, we're so delighted to have Denise Smith, who is the Director of Implementation for the citywide Hope Starts Here initiative. Denise, welcome.
Thank you, Jimena, and greetings, everyone. As stated, my name is Denise Smith, and I am the Implementation Director for Hope Starts Here. I'm going to share my screen to be efficient in my time with you today. So as Jimena mentioned, Hope Starts Here is a citywide engagement and now activation process, which most of you are probably aware of, but is the intent to ensure that Detroit's youngest citizens and their families are supported by a cooperative, responsive, and sustained early childhood system. Being responsive is exactly what Hope Starts Here, its partners and sponsors have been doing during this health emergency. And what I'm most encouraged by during this very devastating time in our lives, how Detroiters have come together in an unprecedented way, I believe, to collaborate, to share data, and gather resources to assist with the needs of families, of children, community, and early childhood providers during this time. Today, I appreciate being able to share with you some very specific activities and resources for early. Specifically, ways to access information and support. As you know, there's the COVID313.org site that is a guide specific for families. There is an early childhood page here that provides at-home learning activities, videos, and more. It's led by the City of Detroit, the CEC, and numerous partners, including Hope Starts Here. And coming very soon, we will have an intentional provider portal that is a one-stop resource for early childhood providers, particularly those who are in service currently to essential workers. This portal will be able to find a number of resources that will help these providers navigate resources that have come from a myriad of sources. But we put them all into a singular place so that they have access. We are also supporting that access through one-on-one technical assistance that will be provided by our Early Childhood Investment Corporation partners. They'll be able to help them to navigate applications, to understand better some of the resources that are available, including accessing personal protection equipment, how to get tested, and very intentionally, what has come out very recently, these featured resources that I wanted to elevate today, which is the Child Care Relief Fund grant. Governor Whitmer spoke of this yesterday. It was launched yesterday, and it's providing some very lucrative and flexible financial assistance to all child care providers. And that's important for me to emphasize because we're looking at not only our licensed programs, including GSRP and Head Start if they're providing some cash paying customers, but it's also looking at our license exempt or family, friend, and neighbor providers. So it's assisting all providers with a very simple application, and you can access that application currently at michigan.gov/childcare. Again, once the portal launches, we'll have support to be able to help providers navigate this application to understand its nuances, but it really is very straightforward. And I commend the state for providing a resource that is as flexible. It can be used for rent, for supplies, just for a myriad of resources. And so I think this is a really wonderful resource and want to elevate it. In addition to the subsidy rate increases. Now, these rate increases were actually as a part of legislation on January 1st. However, they didn't go into effect until April 20th. So these rates are available now to providers, and payments will be backdated to that January date. That will be done automatically, so they don't have to go in and resubmit. Those payments will be done, and going forward, they will apply to any submissions for those parents who are receiving subsidy. For the charter rates, I've listed the site where you can go to, again, at michigan.gov, to be able to see how that's playing out for your particular program at its star rating and or capacity or program type. So with that, I'm going to thank you for an opportunity to join you in this community resource that is crossing systems and sectors. I truly appreciate the opportunity to be able to include early childhood in this conversation and discussion and sharing, as it is a critical first step for our children in this community.
Denise, thank you. And thank you for lifting up not only resources for our families, but also for the number of entrepreneurs and childcare providers that are part of the whole system of care for our children, and actually part of our economic workforce for the city of Detroit and across the country. So what we'd like to do is to hit pause for a moment. If there are some questions, Christine?
There are a few more questions.
Okay.
And so is Irenetta and Radrishi still on the phone or on the call?
Looks like he is.
I'm here.
Yep. Great. So what I'd like to ask two questions. The first is, will there be counseling for students and families through this time? And so Denise, if you could speak to early childhood, and then if we can speak to K, and Radrishi, if you can speak to K through 12.
Sure.
Certainly. So as the Hope Starts Here framework, it consists of 6 imperatives and 15 strategies. And one of those imperatives is a specific focus on families, ensuring that they have the resources and are building their capacity not only to be their first teacher, but to be able to advocate for their children long term. And so in providing that as a resource under imperative 2, currently Detroit Champions for Hope are doing that work, and they are situated throughout the community in all of the districts. So they're on the ground providing a resource, and even for them being parents too, have recognized a strong need for emotional support, for building capacity regarding resilience. And so very soon, as a result of imperative number 2 and work that we're doing with Zero to Thrive, we'll be having workshops around resilience, sessions where these concerns and some of the challenges that families are facing can be elevated, and provide resources and conversations where they can work through them. Having personally been touched by COVID, I know that it is, there's a lot that we're unpacking, and we will be continuing to unpack as we are dealing with our own concerns and challenges that we faced and those people who have been touched by it. And so we know that this is a critical point that we have to address. We are happy to think through other ways to not only address it singularly for dads, for moms, but as we look at the community across. And we understand that this is important and one that we will be soon launching in terms of resilience and managing some of the challenges emotionally that we are faced with.
Thank you, Denise, and we are so glad that you that you're here today. Thanks.
Thank you.
I'd echo some of what Denise said. Similarly, you know, in talking with teachers and leaders of the schools, this is definitely a need that has come up. this whole situation has brought about fear. It's brought about feelings of vulnerability. It's brought about a lot of different things in students and families. And so from talking to schools, one of the key points that most of the schools have are these wellness checks. And part of that is so that we can start to ascertain what are some of the social emotional supports that our students and families need. I've talked to school leaders who have done, social work sessions via video conferencing. Last week, we heard from the women at Cornerstone who talked about, helping a family navigate through loss. Using, the social workers from the school. So this is definitely something that I don't think there can ever be enough of, but we certainly encourage families to take advantage of the resources that are available, and schools are looking to support in whatever way we can. I mean, it goes back to sort of, the hierarchy of needs. We can't expect students to learn and families to support the learning if there are other things standing in the way. And so we recognize that and want to do what we can to help students and families get through this.
Right, so this is the last question, and this is for our K-12 folks. Can you make a commitment to co-planning and consulting with students and families throughout the process for reopening school?
Yeah, so this is Etta. I wanted to get my technology right. So I do want to address very quickly for DPSCD, the mental health supports, if I may. So we currently have a mental health support hotline that is operated by our school social workers that runs the same time that our homework hotline runs. It's actually the same telephone number. The number is 833-466-3978. And it's all over our website. And so the important part about that is it's in-time support. And we start at 9 in the morning and we run until 8 o'clock at night. And so, the social workers that are on the call, they have resources to provide. They can provide counseling services for children and families that are calling in. So we really want to make sure this is a tough time, and we want to make certain that we're providing that support for them. We're also doing wellness calls and wellness checks, as many of us are doing, across the country, in terms of trying to make certain that our students and families and our faculty and staff are taken care of. And so during those wellness calls, as we're finding information, that information is being shared so that we also know how to then deploy our additional social work staff, or if we need guidance counselors. We've had to do the same thing with homeless services. And so it really is a way to make certain that we're doing full wraparound. To answer your question, however, about engagement, I would say yes, that we want to make certain that we are maintaining engagement and understanding that engagement takes on a lot of different facets. It looks a lot of different ways, from having conversations with students, to, we do a weekly, through our Parent Academy, our FACE department, we do a weekly parent-to-parent call, to emails that we're getting from staff members and parents all the time. And so just making certain that we are taking their feedback, we're looking at their feedback, and they know that we want that feedback. And then they're able to see that as we begin to continue planning and moving into implementation.
Great, thank you, Etta, and thank you for coming back on. Appreciate it. Go ahead, Rodrishi.
I was just going to say, very similarly, I think in general, charters in general have, we're sort of built on the premise of always looking to our community to help guide our actions. And you'll see that on many charter school boards, there are parents who serve, there are other family members. We regularly have students at board meetings to present different opportunities or needs to us. So I see that this is as an extension of those same activities. It's just kind of the way we do things. Because at the end of the day, it would make no sense for us to come up with a plan on opening schools if we didn't have the support of the community that we're trying to serve.
Thank you, all of you, so much for all of the information that you have given today. And I just want to remind folks that there is a survey that is posted in the chat. If you fill it out, you'll be entered into a raffle for a $25 gift card. And we really encourage you to fill out the survey so that we can better understand what questions families have about learning plans so that we can ask those next week. Thank you all so much. Jimena?
Yes, thank you, and thank all of you. So we're down to the last little bit of our program, and what we want to make sure that we bring back a very important part of us moving forward with our own health and wellness, and that's to have the opportunity to bring back Kimberly Boyd, who is with Spirit Field Yoga and Wellness, who will take us through about a 4-minute exercise. And then we're going to end up with a dynamic voice from Bernita Bradley, who is the Director for Community Outreach for Hope Starts Here. Kimberly.
Good afternoon, everyone. How you doing? Well, I thought what we could do is maybe a few breath exercises, because as we've been learning that if you can change your breath, you can change how you're feeling. So get your hands together like this, and we're just going to give them a rub. And today's magic number, our number for organizing our ideas, is going to be 4. So whatever we do, we're going to count forward or backward from 4. So we're rubbing our hands together and counting 1, 2, 3, and 4. And now take your nice warm hands, place 1 on your heart and 1 on your belly. And take a nice breath in through your nose and blow it out gently through your lips. And repeat, breathing in through your nose and out through your lips. And one more time, in through your nose and out through your lips. And then just relax and breathe on your own. Well, like I said, there are different ways to breathe to change your mood. So the next breath is called Roses and Candlelight. So what you're going to do is sit up nice and tall. I happen to be sitting crisscross on the floor, but you could be in the chair. You're going to take one hand and close the fingers like this. And you're going to imagine, as you breathe in through your nose, you're smelling something wonderful. And as you exhale, gently blow your fingers open like you're causing the flame of a candle to flicker. And repeat, smelling something yummy and causing the flame to flicker. One more time, breathing in and exhale. And we said our magic number was 4, so last time. And 4. And return to your own natural breath and notice how it makes you feel. Do you feel more calm and peaceful or less calm and peaceful? Now, I don't know about you, but in my house, sometimes it's not always calm and peaceful, even though in our hearts we know we love each other. So we're going to learn dragon breath. Dragon breath is the breath that we do when we need a little bit more energy, or when maybe, you know, the people that we love have kind of gotten on our nerves a little bit. So what you're going to do is you're going to breathe in like you're sucking the air in through your face and making your body really tight. And then you're going to blow it out like a dragon, all right? We're going to try that 3 more times for 4. Ready, and 2 more times. And by now, hopefully, maybe you're laughing, but one more time. And then return to your natural breath and notice, do you feel maybe a little bit more peaceful and light? And let your body just rock gently from side to side, like a beautiful tree in a beautiful breeze. So now trees grow from the ground up. So for our last exercise, just bring your body in tight, make your body into the shape of a nice round seed. And what we're going to do is count to 4. And as we count, we're going to grow and stretch. And so we are becoming a beautiful tree. Ready, and here you grow. 1, growing. 2, growing. 3, growing. 4, now stretching your beautiful branches out. And let's add a little creativity. Uh-oh, here comes a breeze. But you know what? Trees are really strong. They blow in the breeze, but their nice strong roots keep them from falling down. I think there's a lesson in that for us these days, that no matter how challenging things get, we might blow over, but we don't fall down. All right, and bring ourselves back to calm in 4 and 3 and 2 and 1. One hand on your heart, one hand on your belly. All right. That's what I have for us today. Check in with your heart. How are you feeling?
Kimberly, you have us feeling wonderful, and you reminded us if we are rooted, then we can withstand the storm. So thank you so very much. So we're moving to our last speaker that I'm so delighted to welcome. Many of you know her, Bernita Bradley, the Director for Community Outreach with Hope Starts Here. Bernita, welcome.
Hello, thank you, Jimena. How are you?
Blessed.
Good. So, so just wanted to check in with everybody and let you know what our community outreach specialists are doing with Hope Starts Here. So currently we have, Denise spoke about it a little bit, so I'll speak just a little bit more about it. We have 21 community outreach specialists that are working with families to engage them by phone, by email, helping them to access resources, and even not just doing that, but advocating for families and child care providers and community providers. We are advocating to make sure that our parents have what they need, that access is available to resources, that even resources that are being presented, that they're thinking about parent voice in the midst of it. We're making sure that our parents and those in our district, so all of our community outreach specialists work in specific districts, the districts that they live in, and we have some in every district for the city of Detroit, all 7. Our advocates also partner with Brightmore Neighborhood Alliance, as well as Congress of Communities, to actually implement programming in the community, or connect families to programming that's implemented in the community, like Brilliant Detroit, Detroit Parent Network, any resources that are being shared, our community outreach specialists are sharing that. Also, wanted to tell people that Monday was Detroit Day of the Young Child. And so what we did for Monday was, we normally have events everywhere in the city. We normally have almost about 200-300 events. But this year we couldn't do that, of course, because of COVID. So our community outreach specialists, they hosted videos and showed what their families were doing around the 6 days in the community and with their family. And some of them hosted dinner parties with their family, but we were asking people to do those 6 things. Hug your kid every day. Make sure you play with them, encourage them, read to them, speak with them, and sing with them. And it was so funny because my little grandbaby was singing and everything. And so we posted those videos. We're asking families to please post some positive things that you're doing. We know right now that this is a hard time. We know that families are going through, and we know the community members are really sticking together and making sure that one another have resources and are out there getting food and all these other collective things that they need. But post some fun things that you're doing also. Hashtag Hope Bills when you post those things, and just show the community what you're doing. Think outside of the box when you do post them. We ask you to post videos, photos, and even do some live chats. So to just speak to parents just a little bit, I want you to understand that you are the biggest advocate that your child has right now. You know what you're going through in your household. This is the perfect time, like so many other people on here said, to advocate for what you need, to advocate for change, to advocate for things that you've seen that has been disrupting this world forever, right? It's been disrupting our education systems for a long time. But right now, you have voice, you have social media platforms, you have the COVID313 Town Hall to even share with people so that they understand what's actually going on in education with our kids. It's a shame that we are just really getting acknowledged as a people who can get fair education, right? No, Detroit deserves better. And we know what our kids need. We know what our children are going through. Make sure your voice is heard. Contact some of the programs that you've seen today. Stay connected. If you know someone who is not connected to programming, connect them to people who are on this platform. Connect them to the Detroit Parent Networks, the Brilliant Detroit's, Hope Starts Here. Connect them to us. You can go to my page. You can go to Busy Bees and Busy Bee Here to Help, and you can connect them to resources that they need. And so with that being said, I just really want you to know to be encouraged. The last thing I will say is that we are all creating new social norms for ourselves. A lot of people have said that we're getting back to that homegrown, having dinner with your family at the table. We're forced to do it, right? But take time and just make this a new norm for your family, that after this is over, we don't go back to the norm of eating out our car all the time. We don't go back to the norm of doing some of the things that we were like, hey, I haven't done this in a while with my kids. I haven't did jumping jacks with my kids. I haven't just ran around the backyard with my kids in a while because we were so busy. Now that we are home and we are stable with our kids and being hopefully safe and secure with our kids, enjoy that time and make it a new norm moving forward so that you appreciate it. Write about it, tell your story, let nobody else tell your story. You know what you're going through best, and make sure you are at every table that wants to tell your story, you tell it yourself. And thank you. I just want to thank the COVID313 team for even allowing us to be a part of it, right? And allowing parents to even have these resources accessible on a weekly basis.
Actually, thank you. Christine.
So we have reached 1:59, and it's time to wrap up. We probably won't get out of here right at 2, and so I apologize for that, but I'm not going to talk fast because then the translators will not be able to translate. So I want to thank all of our panelists and thank each of you for joining us today. If your question wasn't answered live, we are committed to getting the answers and posting them on next week on onepbs.org. Again, we'll be here every Thursday from 12 to 2 to bring you the most up-to-date information. Next week, we'll have a special segment on Tuesday about Cinco de Mayo. Please join us. And we'll also have a segment next Thursday on parenting during the COVID crisis. We have a few asks of everyone this week. We urge you to take action with us, and we urge you to take action that the governor settles the right to literacy lawsuit by texting READ 313 to 52886, and that should be on the screen right now. When you text, that will send you another text message and encourage you to call the governor today. There's also still time to fill out your census. It should take most people 10 minutes to fill out. These 10 minutes will ensure we have the funds for education, healthcare, food, and emergency services for the next 10 years. Encourage your friends and family by participating in our sidewalk challenge. #WeAllCount. And before you go, we really want to hear what you want to hear about. So please share those topics in the Facebook chat or by texting 313-288-2082. The survey is also posted in the chat. Please take a minute to fill it out. If you fill it out, we'll enter you into a raffle to potentially win a $25 Visa gift card. This town hall is truly a group effort. So right now, I'm going to ask all of our partners to turn on their video so that our audience can see who is behind the scenes, making sure that we can bring this to you every week. And we want to remind everybody in this time, stay healthy, stay powerful, and stay strong.